Good afternoon. I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners. And today is January the 10th. I want to give you a quick update on our COVID situation and status. Currently, we have 10,592 positive cases identified. We had a daily increase at our last report on the 8th of January of 181 cases. Our hospitalizations have gone up significantly. After Thanksgiving, they plateaued around 60, which is double the rate of 30 in the high point in July. And now we're surging on top of that surge. And we haven't seen the last of the New Year's Eve and Christmas infections come through in terms of presenting themselves in the hospital. But at this point, we're averaging around 75 daily count. Obviously, this puts a tremendous strain on our hospitals, our nursing staffs, all the healthcare providers that work in those environments are pushing the limit. And our health department is pushing the limit. So we need your help in trying to slow this spread while we're waiting for a vaccine to be widely available so that we can achieve greater community immunity. Speaking of a vaccine, as many of you know, both Pfizer and Moderna have rapidly developed a new vaccine. That's a result of Operation Warp Speed at the federal level, which funded what normally is a process that doesn't attract a lot of capital. So vaccine development has never been particularly high on pharmaceutical companies' lists of things to do. Well, as a result of Congress and the administration pushing money towards those research efforts in warp speed time, they have developed two new vaccines that were basically approved for use, emergency use, in late November, early December, and as a result have now been distributed for initial inoculation. And I'm going to call getting a vaccine getting a jab. That's what the Brits call it, and I think that's probably a good shorthand to to use. We've had in this county 124 deaths so far. Under any other circumstances, if we had had 124 deaths, that's 12 to 13 per month, for any other cause, people would be up in arms about what we were doing to stop this carnage. And that's what it is. And what we can do is in your hands and over your mouth, on your face, and how far you stand away apart from other folks and socially distance, and how you practice personal hygiene in terms of washing your hands and keeping surfaces that are contacted by multiple folks clean. Those simple 3 W's are what will keep us from busting through the capacity of our hospitals. You can see what's happened in Los Angeles. It's a mess. We don't need to be replicating what's happening in California and some other areas of the country. So I'm going to ask you again to double down. The vaccine is sort of like the cavalry coming over the hill, and it's arriving initially in small numbers. I would ask you to pay particular attention to our health department director, Jane Henson, who has also cut a video that explains a little bit more about the particulars of these vaccines and the confidence that you can have in the fact that they are safe and effective. 95% effective rates for both generally, is really unheard of in the vaccination world. Usually you're happy if you can get 70 to 75% effective rates for the flu at any rate. Now, the process right now is governed by state law, which is taking its cues from the CDC about the priority of distribution. And the initial priority distribution went to our frontline healthcare workers who are exposed on a routine basis and are so critical to be able to care for those who are hospitalized. The initial distribution of Pfizer, which is a difficult vaccine to logistically manage. It requires refrigeration at extremely low temperatures that very few organizations have, and therefore they can't use that vaccine effectively without running out or having spoilage. So our hospitals have been able to use that effectively to inoculate their staff and are now working on providing the second round of vaccines, because this is a two-shot vaccine process. And once that's completed, then as they get additional stockage or they are able to help the county in terms of using our stockage, then they will be putting their shoulder to the wheel. In fact, they already have. With some excess numbers, they were able to schedule by appointment some individuals that were identified as particularly at risk, meeting the criteria of being over 75 from our healthcare providers. But what we're looking to do is to get as many people inoculated as possible. And we're looking to be both effective, efficient, and to be equitable in how we approach the distribution of that opportunity. Now, right now, the focus is on effective use of what we have. That means maximizing the number of jabs in Iredell County residents. And to date, we've had 2 clinics that were open to over 75 years of age folks that didn't fall in some other priority category. And as a result, in just 1 week, we were able to inoculate over 900 individuals. That that basically used up our stock. That is a much better track record than what you see throughout many other counties in the state of North Carolina. You know, the state of North Carolina is administering this process, and we are working with a computerized input system for registration, as well as a call center that was supposed to be up and running. Well, the results are the call center is really not functional effectively, and the ability to get data entered into the state system is very limited. As a result, it's fallen on local communities to stand in the gap and to pick up the slack. And that's what our health department has done magnificently. In terms of being effective, in terms of getting the most people inoculated possible, over 75, you know, you're looking at close to 900 folks that have been inoculated at this point. To give you a little comparison, in Wake County, Raleigh, they have not yet administered any vaccines to folks over 75. In fact, they won't even begin to until January the 19th. And they're doing so using an appointment system. And you get a lot of folks saying, why can't we just do an appointment? Because people don't want to wait in a line for 3 or 4 or 5 hours. But to be effective, we've got to get as many people inoculated as we can. The lines, it's first come, first serve. So obviously, there's a point at which we have to cut off folks in line because we've reached the vaccination capacity. And so the fairest way to do that is just first come, first serve. Now, there are certainly some folks out there who are not able to sit for 5 hours or who are homebound, have individual situations. And our goal is to be not just effective, but efficient in how we administer the vaccine to cut down on the waiting times as best we can, and also to be able to get the jab in folks who just aren't able to participate in that process. And we're working on that together with our healthcare providers to work up a appointment type process. But we're not quite there yet. So I'd ask you to be patient as we work through how to leverage all the resources that we do have. So to be efficient, when people line up, we're counting the cars, we're counting the people in the cars to the point where we run out of vaccine capacity. Folks that are behind, we're letting them know as quickly as we can that there's no more vaccination available. But at that point, it will be hours before we are actually completing the process. We have people on station that show up, they put out cones, they get the tents set up, they get all of the infrastructure there starting around 6 o'clock in the morning. And then the individual vaccines have to be constituted. They have to be drawn. They have to be set up so that when we start the inoculation process, it can go quickly. But then there's a 15-minute period of time where everyone who gets the vaccine has to be observed so that if there's any kind of adverse reaction, people can respond to it. And by the way, there haven't been any adverse reactions to date of any consequence. So we just ask your patience in this process. Our nursing homes are being taken care of by strike teams from drugstores like CVS and Walgreens. Not anybody can give this vaccine. It requires approval by the state. And individuals and organizations have to meet certain criteria, not only dealing with the administration and observation portions of the vaccination process, but also in terms of the storage process of these vaccines. And as time goes on, we learn and we go through a constant process improvement process. And as more vaccines come online that are less onerous in terms of refrigeration requirements, or who maybe even just require a single administration, then we will have much more availability throughout the county for our citizens. It's a good sign, I can tell you, that we're getting the jab in people's arms because we've got people from other counties coming into Iredell County. We're all North Carolinians. It's all one system. But we're trying to put our shoulder to the wheel and lean forward just as hard as we can. And take your time to thank the staff at these sites. They work for 12 hours in inclement weather. If it's not cold, it's wet, or it's wet and cold. And there's a lot of folks that can be frustrated. And I'm going to let you know about a couple of things that are a little aggravation to me. Folks that have to be 75 or older to qualify. Well, that doesn't mean that the person driving the car, who's a caregiver or the child or the nephew or whatever, that person is not qualified to receive the vaccine. So don't, give the nurse who's trying to help the person that's over 75 out what for, because they can't give you the vaccine. Another thing we found out, we didn't really think this was going to happen, but when we counted down cars and validated the number of people in the car that qualified for vaccination. We went down and counted out the 400 or so that would be able to get the inoculation. And then when it came time, and when they ran out, there were still people there in cars that we thought were going to be able to get vaccinated, but there wasn't any more vaccine. And why was that? Well, that's because people in cars that didn't make the cut further back in line got out of their cars, got in the cars that were in front, and you had more people in the car over 75 that got the vaccine, and then some people who had been waiting and anticipated getting it, and we planned to give it to, there were no vaccines to give them. So, that was just people cutting in line. That's just a disappointing kind of thing to do. So now you can expect that people will be inventoried in the car. So we'll know exactly how many in every car are going to be vaccinated. And if there's more than that person, if one person's supposed to get it and there's two people in the car that are over 75, y'all gonna have to figure out which one's gonna get it, because there's only one person gonna get vaccinated. So we need to work with each other and show some grace and some patience as we go through this process. Everyone will have the opportunity to get a vaccine. In the meantime, we need to follow the 3 W's and realize that after you get the vaccine, you're still going to have to follow the 3 W's, because we don't know how long the vaccine will be effective. We know that if it's 95%, there's still 5% out there that can become infected, or they may be asymptomatic. The good thing is, I think 100% of folks that get it, if they subsequently are infected, will have a less severe case and not require hospitalizations. That's what we're trying to avoid. So I encourage you to stay tuned. We have a call center number that you can call locally and find out what's going on when the next clinic is, or answer some questions you may have. We have our website, and you can visit both of those, or those should be on the screen to give you the number. So I would encourage you all to plan ahead and keep your ear to the ground, and we will all get through this in good order. But it's darkest before dawn, and we are going to continue to have large numbers of folks come down with COVID with serious consequences of hospitalization and death. So it is deadly serious. So good luck and Godspeed, and I'll see you on the high ground.